Welcome. I'm Dr. Robert Cardam, and I'm a licensed psychologist at Counseling and Psychological Services in the Center for Behavioral Health Promotion and Applied Research at UAlbany. Today, I have the pleasure of interviewing our Director of Clinical Services, Dr. Joyce Dewitt-Parker. Welcome.
Hi.
Hi. So the goal of today's interview is really to help address how college students can cope and manage mental health during states of uncertainty. Especially right now, we do have coronavirus going on. We really wanted to interview someone who has a lot of skill and background in clinical services to help students understand how best to manage. So the first question I have for you is, what are some of the common emotional reactions that people are having to COVID-19?
Oh, well, when I think about reactions, we're all in the same boat, unfortunately. So the reactions that students are having, other folks are having too, their faculty members, their instructors, family members. But some of the common reactions are stress and anxiety about this uncertainty that we're all facing. Some other issues that I find include just being disappointed about the fact that plans have changed and events have been rescheduled or postponed. And that can be stressful, especially when students have been looking forward to the next, couple of months of their semester. Sometimes sadness can impact people in some surprising ways. I think given the stressors, and in addition to that, I find that since we're having different reactions to the stressors, it's sometimes hard to understand how best to respond to it or even to name what we're going through. So for example, if you normally would experience sadness, it might be expressed as being irritable or edgy or annoyed or frustrated. It could also be sadness or the more typical reaction to anxiety, but it could be expressed a little differently.
So in addition to some of those emotional reactions folks might have, I'm also wondering if there's other reactions you're noticing or might suspect folks are having right now to COVID-19.
Mm-hmm. Sure. Our routines have changed at this point. So given that we aren't in class or at work as we normally would be, we have to find a new normal routine for ourselves. And so that means that our sleep schedules may be disrupted, our exercise schedules could be changed, and even the times that we might choose to eat have changed. So our schedules have been disrupted, and that can be a little bit off-putting, and it can make us feel just not quite ourselves.
So we've talked about some emotional reactions folks might have, also maybe changes or disruptions to schedules. I'm wondering, any other reactions or things that folks might be dealing with right now with COVID-19?
Yes. I think about the term social distance. So that phrase in and of itself, I think is a misnomer in a way. We're creating some physical distance between ourselves and others, but because we are less likely to be out in social settings, we can feel more isolated than we felt in the past. And then I also think about some particular groups of students who might feel especially marginalized and feel isolated in a different way, because they may feel that their particular cultural group has been targeted as problematic given this crisis. And we know that that's not the case, but nevertheless, people feel marginalized because they've been targeted by various groups. And to be honest, I'm talking about our Asian students and Asian American students in particular. Some of our international students have felt marginalized as well. And so that leads to a different level of isolation.
Thank you. And so we've talked a bit about emotional reactions, changes to schedules, experiences possibly of marginalization, and other experiences related to COVID-19. How can students cope with all of these changes, emotions, and experiences?
Okay. Well, there's some healthy coping strategies as well as unhealthy coping strategies. So first, I'd like to focus on healthy coping strategies. This can be really useful because, we're trying to develop new routines, and why not have some healthy coping strategies be a part of those routines? Um, one thing that we might want to do is limit the amount of time we're spending taking in new information. It's really important to be aware and updated, especially given that the situation changes on a daily basis sometimes. But to cope in a healthy way, it might be useful for us to limit how much time we're gathering information on a daily basis to maybe 2 or 3 times a day or once a day even, so that we don't feel overwhelmed by that. So that's one coping strategy.
Mhm. So I'm hearing actually decreasing the amount of time we're actually taking in information that might be stressful.
Right, that's one. I think there are others, such as practicing mindfulness, exercising. If you can get out to walk or exercise, there are also virtual exercise programs that people can tap into on YouTube and various other platforms. So exercise is really, really useful. Developing some, structure to your day by getting up at the same time, going to bed at the same, and eating along a regular schedule.
Mhm. Yeah, so a lot of kind of keeping your schedule going, keeping things going as if uh, as things were going before in terms of how your day is structured.
Mhm.
You also mentioned mindfulness. Can you say a little bit more about what mindfulness means?
Mindfulness is a neat little practice. It's based on Buddhist psychology, but being mindful means that you stay in the present moment, you're aware, and you walk without judgment. And it's a beautiful little principle. And if anyone is interested in learning a little bit more about mindfulness, you can actually visit our webpage. We have mindfulness apps on the webpage, as well as some other apps and material and information there.
So you mentioned mindfulness and resources, and even on the website. What kind of resources are there on the website, the CAPS website for mindfulness?
Well, we have a mindfulness app. There's several actually that you could take a look at. And for students who are very interested in mindfulness and want to take it to a different level, we have a mindfulness program that has started in the virtual space. So if you visit our webpage, you'll be able to find out a little bit more about how to tap into that and get connected to this mindfulness program.
Thank you. So you mentioned mindfulness, you mentioned sticking to your routine, having some structure. And I'm also recognizing that a lot of people use friendships to cope. And right now we're telling people to distance themselves, especially physically, in order to prevent COVID-19. Um, how are folks supposed to continue to cope with that social distancing piece?
Okay. All right. Yes, we talk about social distancing, but it doesn't mean that we have to create, and actually that's more physical distancing. It doesn't mean that we have to create emotional distance from those people we care about. And we can think of creative ways to stay connected socially through virtual get-togethers, checking in with our friends or family members. And I think, especially in this virtual space, people may find that they want to check in with their social network more often. So, and instead of reaching out to someone once a week or even once a day, it might be several times a day, but certainly more often than typical. So staying connected socially through social media, the phone, texting, popping in just to, chat briefly with someone over virtual space could be really important. And there are many spaces on campus for students to tap into. We mentioned the mindfulness group program that is going on through CAPS. And what I would suggest that students do is look for other opportunities that may develop on CAPS webpage and CPH-PAR webpage, as well as throughout the university.
And that leads me to my next question. So you mentioned ways to cope with schedule, routine, and then also keeping that social connection is really important. And I'm also recognizing that folks don't always know how to cope best. What are some of the unhealthy coping styles that maybe we need to watch out for and replace with some of these healthier styles that you're talking about?
So yes, there are some unhealthy ways to cope with stressors, and this might include increasing your use of substances like alcohol, tobacco, nicotine, marijuana. Those are not healthy ways to cope, and the reason for that is they could lead to more emotional disruption, more anxiety. It impacts you in a negative way. So we suggest to students and people that they really focus on exercise and some of the other healthy coping mechanisms we've mentioned.
Thank you. What are some signs that people can look out for that might suggest that they're experiencing higher levels of distress that could mean that they could use some additional support, like counseling or other types of additional support?
Well, I think intense and extreme emotional states. So for example, if someone is having trouble getting out of bed all day, or they're spending most of their day crying, for example, those are extreme emotional states. But there are others too, like extreme anger. If you're not able to focus your thoughts well, but that might indicate that you would want to talk to someone. And although we are not actually available at CAPS, the CAPS staff are very available in the virtual space and remotely. So if a student should need help and would like to speak to a psychologist, a CAPS psychologist, all they have to do is give us a call at 518-442-5800. They can also visit our webpage. They can email us, just as a student could email us when we were on campus, and a psychologist will be back in touch with them to speak to them on the phone and to help them to schedule additional services that they might want to need.
So you mentioned ways that students can connect to CAP services even virtually during this time. And I'm wondering if someone's concerned about someone being in an emotional crisis or needing emergency services, what should they do in that situation?
Okay. I think in a situation like that, it would be important to do several things. One, if there is a support person who's with you physically in that space, please talk to that person who can be helpful and call 911. That would be the best next decision to make. If someone visits our webpage, the CAPS webpage, we have information about that very thing, how to handle an emergency, call 911, for example. And then listed with our COVID-19 resources, we also have some national hotline information that any student, any person might find helpful and useful.
So we've talked a lot today about how folks are experiencing this COVID situation, how they're coping or how they might cope. How are you coping right now? What are you doing to take care of yourself during the COVID situation?
That's a good question because many people are tethered. There's several things. We're tethered to our computers in a different way than we have been before. And, because of that, I think it's important to take frequent breaks. Another way that I'm coping is exercise. I love to exercise. It's always been a part of my day-to-day routine, and that hasn't changed. So I'm still exercising. The method of the exercise has changed, though. So I have found virtual exercise classes. I'm getting out and I'm walking my dog more often, for example, but I especially like virtual Zumba
Hmm,
classes.
great. And just kind of ending here, any last things that you want to make sure that folks know in this time?
Well, what I want folks to know is that CAPS is open, but not physically open, but open virtually and remotely. So just as we are conducting this interview through Zoom, we use that same platform to conduct counseling sessions. So I want students to know that we're still available to them by phone and by video conferencing for any of their needs.
Great, thank you. So this was an interview with our clinical director, or director of clinical services, Dr. Joyce Dewitt-Parker at Counseling Psychological Services at UAlbany. Thank you, Dr. Dewitt-Parker, for speaking with me today.
Thank you, Dr. Cardam.